clean the face before injecting with an antiseptic. Donc ça va un peu piquer là. So we're going to start on the nose injection right here. So as I'm cleaning all the face, I remove all kind of risk. So for male, normally we don't have makeup, or if there is makeup, you have to remove it before you use the antiseptic. Voila. And before I will do any injection before I will use the antiseptic. Right. Alors. So the product we're going to use is Stylage XL with lidocaïne with a needle of 27 gauge. Alors Dan, you ready?
I'm ready.
Okay, we start. So the first injection point is right at the nasolabial angle, yes. Okay. So we inject very slow. Ça va?
Ready.
Mm-hmm. Okay, so we use all the length of the needle down to the nasal spine. If you don't know where you are, you have to touch the bone, but it's painful. Normally, all the length of the needle is enough. And you see how slow I'm going. You see the flow on the piston. Because you have time to the lidocaine to act. And this is how you can inject softly and not so painful. Because a lot of my colleagues, they said, wow, this is painful. But you see, I mean, Danny is a great guy. Doesn't complain. But yeah, if you go slow, it's easier. So we already injected 0.5 ml. Voila. Now I need to do a little trick. So this is a trick to inject on the columelle, which is a step 2 of this technique, which I call it the Eiffel Tower Nose Lift. The first is a footage on the nasal spine. The second injection point is the same entry point, but it's on the columelle. And because we bend the needle, we can go in between the two alar cartilages. Voilà. And that supports the tip and lift and project the tip. You see, it's not that painful. And with the same entry point, we can create a good shape and a good support on the tip. Well, and the step 3 would be to go on the tip from the same entry point. So we don't need to over inject that area. And I don't like to inject on the tip because this is a triangle with a soft triangle with a light projection. And we don't want to change that. We already injected 0.8 ml on the nasal spine, right? And now we're going to finish, so I'm going to change the needle. We're going to finish on the nasal bridge. On the nasal bridge, I come on the left side, as I am right-handed. I pinch the skin here and you inject right down to the bone medially. So all those injections are safe because the arteries, they run laterally to the nose and then give some branches, but never on the midline. So that's why I like those injections, this Eiffel Tower technique, injecting really medially. Okay, and I try to do everything with one syringe. Of course, we can use more, but for the budget, if you can do with one syringe all the procedure, it's good. Okay, and this is 0.2 on the nasal spine, and roughly we have something straight. It's important not to over-inject the nose and especially the tip, as on the male we don't want something pointy like this. On a female I would inject a little bit more. Ça c'est bien. And injecting medially, you don't have the product that's spread laterally on the dorsum and here. So also because of the rheology of the product, Stylage XL is very cohesive, so it stays as a bolus, or the shape remains the same. Voilà.